Some of what I've heard, it's a little scary. It's confusing. And some of it is a little reassuring. Some of it, I think if people got the facts and understood exactly what AIDS was and the difference, then maybe it would help.
We're all scared to death. We'd like to know what the hell we're supposed to do here. What should we do? Should we stay home and lock ourselves back in the closet? Or, what should we do?
And how about unsafe sex with one girl?
Absolutely no risk, man.
And another?
No risk.
Another?
No risk.
And another?
Definitely no risk. No.
I'm sorry. You
What?
Over the past 4 decades of the HIV epidemic, HIV stigma has been persistent and destructive, fraying the fabric of human connections that make up communities.
There was this prime time TV advert of this tombstone that kind of falls and crumbles.
We're talking about the 80s, 80s, early 90s. It was a stark contrast between how white gay men were portrayed and how black women were portrayed. How she was described in media was prostitute, or she was turning tricks for some crack.
I don't understand. This is not a woman's disease. Tell that to the 16,000 women who have it. They use drugs, and they do perverted things.
You get HIV, you die. You get HIV, you get AIDS, you die. It was always that cycle.
Yeah, it's very hard to talk about this.
As quiet and obscure as a whisper, or as loud and violent as a protest, stigma reduces us to something less than human. The definition of stigma is straightforward, a mark of disgrace associated with a particular circumstance, quality, or person. But uncovering stigma and addressing it at its roots is far more complicated.
People are still being blamed for getting HIV. People are still being criticized for engaging in sex at all. How are they able to accept themselves if society and the places that are supposed to be safe for them are not safe?
HIV stigma involves a set of negative attitudes and beliefs about people living with or affected by HIV. It is the prejudice that comes with labeling an individual as part of a group that society deems socially unacceptable. As a concept, it sounds abstract, but for so many, it is a daily lived experience.
I got taken to another room where they were going to do a second test to confirm, while sat there being like, oh my God, how is this going to affect my life? They put a biohazard sticker, which they obviously needed to, but I just sat there being like, oh, I'm a biohazard now. Great.
We all want to be accepted, especially when you are from a community that is hugely impacted by ignorance and bigotry and lack of love and understanding.
Nearly 3/4 of people living with HIV recently surveyed in the United Kingdom reported having experienced stigma due to their HIV status.
I have heard stories where people have received stigma at work, which has resulted in them losing their job, losing their house, having to live in their car, becoming unwell, and having no income.
In South Africa, where 1 in 9 people live with HIV, employer discrimination is widespread and rampant, with some companies dismissing workers living with HIV or hiring those believed to have a low risk of infection.
Companies require people to do an HIV test, and if it comes out positive, they sometimes don't get the job. A lot of people don't even know that is why they did not get the job.
And in the United States, people of color account for about 66% of new HIV infections, with the greatest burden borne by African Americans and Latinos. They are made vulnerable to HIV by inequity and racism alongside stigma.
In the US, for example, HIV impacts disproportionately Black African American men and also Latino men. We have to address the social and economic disparities, and that also entails addressing racism as a public health threat.
Since the start of the epidemic, HIV stigma has fueled new HIV infections and AIDS-related deaths. It is still doing so today. In healthcare settings, stigma is impeding access to and the use of HIV testing, prevention, treatment, care, and social support services.
I've been in situations where my doctor was someone who was full of implicit bias and who was heavy on the stereotypes. If I don't trust my doctor, it can have severe implications and complications with my health care.
But it extends well beyond the healthcare sector. It is found in every aspect of social life, domestic and community environment, educational and workplace settings, and within the justice system.
HIV is not just a disease of the body. It also touches poverty. It touches unemployment. It touches drug and alcohol abuse. So if we don't attend to the structural drivers of HIV, then we will not win the war on HIV.
The Joint United Nations Programme on HIV and AIDS, or UNAIDS, has set a benchmark that by the year 2030, less than 10% of people living with HIV and their affected communities experience stigma and discrimination. If we do not strive to bring that number closer to zero HIV stigma, if we lower the bar and accept the world as it is, we miss an opportunity to shatter the status quo, denying people around the globe the right to dignity, health, and well-being. But this story is not about data or defeat. This is a story about being human first.
I am James Oladipo, a clinical social worker and researcher working with the Richita Project.
I am Lydia Joyce McNeil. I bring you greetings for the beautiful city of Grit and Grind. That's Memphis, Tennessee.
I'm Alid. I am 35. I use he, him pronouns, and I live in Bristol in the UK.
My name is Victoria Cordova. I am from Argentina. I'm a trans woman. I'm also Latina. I'm an immigrant.
My name is Zonke Ndlovu. I live in Kwamashu, a small township outside Durban in KZN, South Africa.
I'm Damian Cabrera, and I am born and raised in Puerto Rico, and I am an HIV advocate living in San Juan.
My biggest fear was that I was never going to have a relationship or sex again, and I'd never have any friends because they would all think that I'm disgusting and they'd run away from me. Like, I had just visions of the blob. Like, it's gone in me, it's now going to swallow my friends, it's now going to take over my life, and it's going to ruin everything.
When I left the hospital with the HIV diagnosis, I thought that my life was going to end. The memories of the friends that I lost in the 90s came to my mind. I couldn't tell anyone for 14 years.
A lot of culture and religion, especially in Africa, are still very conservative. So things like sex amongst young people, amongst unmarried people, is still seen as problematic or seen as immoral.
As a country, we were facing a lot of people who were sick and who were dying. And people just became scared of coming out.
While stigma can manifest at various levels, in this documentary, we are focusing on 3 forms of stigma: institutionalized, interpersonal, and self-stigma, or internalized stigma. Institutionalized stigma is systemic, involving government policy, organizations, and healthcare systems that intentionally or unintentionally marginalize people living with HIV.
Where I fetch my medication, there are 2 clinics. There is an old clinic that we were using before, and then there is a newly built clinic, which is a very beautiful clinic. People who are living with HIV, TB, mental health, we still go to the old clinic. So there is that segregation of patients. Most of the people I know are fetching treatment outside Kwamashu. They have to pay a lot of money just to go to fetch their medication because they are scared. Someone will see them, they'll recognize them, and then their status will be known in the community. You feel the eyes of the people and you feel like everyone knows my status.
these structures that, for example, are there to support you and to provide healthcare to you have their own bias. One of the biggest barriers to accessing PrEP is provider stigma. They feel that by prescribing you with PrEP, they are giving you permission to have condomless sex or to be promiscuous. By having their own bias and their own stigma, many providers deprive you from the tools that you need to protect yourself from HIV.
You see nurses telling people living with HIV that I did not tell you to go get HIV. I did not tell you to do this. I did not tell you to do that. Why do you engage in things like anal sex? Why are you sleeping with other men? Or why do you engage in sex work? All of you that are here for your HIV medication, come to this queue. That's people's statuses being disclosed without their permission. And what that means in some instances is people disengaging from care. People would tell us that I'd rather not go there. I'd rather not take the medication. The clinics are supposed to be safe spaces for people where they expect to be treated with respect, and we just keep leaving the country behind.
I've been in situations where my doctor was someone who was full of implicit bias and who was heavy on the stereotypes. If I don't trust my doctor, I'm not able to fully advocate for myself, and that leads to a lack of self-efficacy. You know, when we have those conversations, I want to meet your trainings, I want to meet your education, free of your implicit bias.
Interpersonal stigma arises when someone discredits, devalues, or shames someone because of perceived differences. It can lead to isolation, rejection, marginalization, and discrimination.
People living with HIV don't have to worry about their status alone. They also have to worry about disclosure. Things like rejection, loss of employment, sometimes violence from partners, from family members. They get kicked out of the house.
One of my cousins was sick, and she didn't even tell us what was wrong with her. They were told she was bewitched. Some others said she needed to do some rituals, which we did. A week later, she died.
You start seeing conversations on social media, and you start seeing how your friends react to HIV unprompted, right? It became very loud. One of the things that came up was like, you know, if Black women stopped having sex with gay men, they wouldn't get HIV. If they weren't so promiscuous, if they didn't do this and third, they wouldn't get HIV. Or God is punishing you for bleach on them and these type of things. And so when you see that play out, it's hard not to internalize it.
Not only with HIV, but when you are a different person from the LGBTQ community, you experience rejections from an early age. So for me, like trying to find a love, someone who I want them to love me, and then they said, oh no, you are HIV positive, I can't be with you. It was so hard for me to disclose because I was an immigrant, I was a trans woman, I was HIV, so there was a lot of layers.
And I've had numerous messages sent to me on various dating apps. I'm murdering my community. It's people like me that deserve to have HIV. You shouldn't be looking for sex. Why are you on here? You're dirty. Instant blocks. But I like an instant block because I just see it as the trash taking out themselves.
One of the folks that we were interviewing shared this story about how he shared his status with his family, and he was put into a different room, and that he had different set of plates, glasses, everything just for him.
Self-stigma is perhaps the most insidious of all. When we hear negative messages, we internalize shame, develop low self-esteem, and at worst, give up entirely.
A lot of studies have shown how there's a connection between living with HIV and mental health issues. In social circles where they refer to people living with HIV as unclean, people start to see themselves as unclean. If you see yourself as unclean, why take a medication to want you to feel better? And it leads to issues like suicide ideation, to depression, to anxiety, ultimately just disengaging from care.
The first thought I had was, who marries someone who's HIV positive? My inner critic got real loud. My inner coach got muted. How do I navigate this to keep this a secret? And you ain't always got the time to try to navigate this secretly. Like, I went into isolation. I didn't think I could trust anybody. I kept a note in my phone because I was like, if anybody finds out, it's one of these people that told. When I went to go see case managers, I just parked in a different part because I didn't want to be seen walking into that building because that building is stigmatized. You know what I'm saying? That building is stereotyped as those who got HIV go over there. So I had my story together because I'm a sorority girl. I got sorority plates on the back of my car. So if it was ever, oh, Lydia, we saw you. Oh, girl, you know, I was doing, you know, my community service. I was there for philanthropic efforts. And it's like you putting on a personality that's not true to who you are. And you no longer get to live in your genuineness or your authenticity. Damn. You know, that's how powerful that shit is. Because of that secrecy, it impacts your mental. And whatever impacts your mental and your emotional impacts you in your health. So all this stuff is a 360.
You know, I couldn't tell anyone for 14 years until last December when I realized I don't want to carry on with this any longer. You know, the average lifespan for a trans person in Latin America is 35 years old. You know, I will be 52 in 2 weeks, so it's a milestone for someone coming from that region of the world. If I am here helping other members of my community, how can I keep this to myself? I can't.
When dealing with stigma, fear is never the answer. And fear-based campaigns are definitely not effective, not empowering. What are the messages that the community needs to hear, in what language, what visuals? And that's exactly what we were trying to do at the Gay Men of Color Fellowship, which is a program that I manage in my current work. The Gay Men of Color Fellowship gathers 20 gay men of color across the US and Puerto Rico to develop a social media campaign based on their voices. They are the experts on their experiences, and they are the ones that understand the language that community uses, the messages that the community needs. One of the Gay Men of Color fellows, Andres, he has been putting out his own messages, sharing his experiences around HIV as a person living with HIV. I feel lucky to be able to be surrounded by people that are so passionate.
So for a long time, I just thought that I was okay. Like if someone said, "What do you think of this coat?" and I went, it's okay, I'm usually asking for another option here. So I had all of those images of kind of death, illness, and old people going through my head. So I then was like, let's take my mind off it and let's enter this drag competition. This will be cute. That kind of started my drag journey. I always say that I fell into drag by accident, but I've always used my platform or that moment with a mic to press an issue or to raise a point. So if I'm on stage and I've got people literally hanging on by a lash to everything that I'm saying, and I can sandwich a fact or a point in between a joke, then hopefully by remembering the joke, they remember the fact.
So I planned an event called Moment of Transparency, and that was my coming out party. We had a logo, we had swag bags, we sold tickets, we had DJs. It was in a venue, we had food. It was a whole vibe, right? A mini film festival, community event, and a panel of like community people. And I was like, let's go. The moderator for the panel knew. And once the film ended, his first question was like, how do you see yourself in the movie? And then it got to me, and I said, I am someone who has been diagnosed with HIV. I was diagnosed a year ago today, and this is my first time saying it out loud. whole room got quiet. You literally like could hear like a mouse piss on cotton.
I have 3 daughters. When they reach puberty, I had to sit them down at different times. Started with my old one, and I told her that I was HIV positive. I also told her that she shouldn't be scared. I told them how I take my medication. I just said to them, you just need to make sure that your mother takes medication every day, and then I'm not going anywhere. My 27-year-old, she was 3 when I was diagnosed with HIV. She was 3 years old. Oh, and now she's a lawyer.
All these layers of stigma are at the end of the day deeply intertwined. Together, they diminish our sense of humanity. Stigma wants us to believe we are different, we are other, we do not belong.
These different types of stigma, they are all interconnected. It's like a network that's been fed by so many sides. And that in the end, what it leads is to dehumanize us and to make us look as we are less than we are.
In 2023, 42 years after the first reported cases of HIV, we have the tools at our disposal to avert most new HIV infections and avoid all AIDS-related deaths. So why are we off track to end AIDS as a public health threat by 2030? HIV stigma is a primary culprit, keeping people from knowing their status, accessing prevention services, starting on treatment, and realizing their rights to health. The good news? Fast-track cities are implementing community-driven, evidence-based interventions designed specifically to end institutional, interpersonal, and self-stigma. The London Anti-Stigma Charter is an initiative to make London a city with zero tolerance to HIV stigma. It is a critical tool in addressing institutional and societal stigma and aims to ensure that institutions and the services they provide are welcoming to people living with HIV.
The Anti-Stigma Charter is basically going into places of employment, and if you're like a gold badge HIV confident organization, that means that all of your policies and your procedures are great and you're making a concerted effort to make sure that people living with HIV in your organization are seen, are valued, and are safe to work there, delivering training to staff, writing new policies, changing different procedures, and promoting the fact that you are a diverse and inclusive employer.
The foundations of Clinic Q is to fight HIV and stigma, and we're also part of the stigma walk. We marched 2 months ago through London. We are aligned with the Anti-Stigma Charter. Discrimination can happen very behind the curtains, so you will never know. I usually work for people who know me or I know them, and I know that it's going to be safe for me. But the unemployment for trans people is huge. So first of all, you need to get a job. And then if you are happy to get the job, the managers and the boss, they need to have some training regarding trans people and non-binary people. And then if we go for people who are HIV, I think that every company needs to have a training, and it's very important that managers deliver this sort of training. It's crucial to minimize, as I said, the stigma regarding us.
One act of stigma at work can have a dramatic negative impact on someone's life. When I first got diagnosed, I didn't know whether anyone would want to employ me. I didn't know whether I legally had to tell my employer. So to see this come in It's really important for positive people, and it would have been really important for me at the time. I'm really excited and I'm really looking forward to kind of the impact and the change that this could have, because then they can become allies, and we love an ally.
Status neutrality is an approach to HIV prevention and care service delivery that emphasizes high-quality care to engage and retain people in services and de-emphasizes whether an individual is HIV positive or negative.
Status neutrality is understanding that if you're a person that is sexually active, you have an HIV status, whether it is positive or negative, but you do have an HIV status. If you are a person that tested positive, that means that you should engage in care and that the systems should be there to support you. If you are negative, there's also care that has to be related to that to keep you negative. Whether you're positive or negative, there is care associated to your status. Status neutrality, for me, is key to ending the HIV epidemic.
I always say that it's going to take all of us, irrespective of your HIV status. Even if you receive, a HIV negative diagnosis, you still have a part to play in ending the epidemic, for lack of better words. So imagine you're someone who has received an HIV negative diagnosis. You've educated yourself. You know what PrEP and PEP is. You know about, treatment as prevention. You're educated about the modes of transmission. You're igniting fires and normalizing the conversations. And it takes the burden and the load off of us who are HIV positive to have to always be in the forefront of leading the conversation. As we introduce new methods, my sincerest hope and prayer is that there is not an erasure of folks that show up in this world like me. Cisgendered, heterosexual, Black, HIV positive woman.
Undetectable equals untransmittable refers to the result of multiple studies that confirm a person living with HIV who is taking antiretroviral therapy or ART as prescribed and reaches an undetectable level of virus in their blood cannot transmit HIV to their sexual partners. The risk is zero.
U equals to U is undetectable equals untransmittable. When someone that is living with HIV is on treatment, they adhere to the treatment, they become virally suppressed. And what that means is that they can no longer transmit the virus to someone else. Working in this field, I get to speak about the findings of the work that we do. In the recently concluded SA8 conference, there was a presentation in the closing session around the state of U equals to U in the country. The campaign is kicking off in some of the provinces across the country, and they are hoping that there's more awareness around it. It's starting to change conversation. They can still go ahead to marry someone that is HIV negative and have kids, live normal life. They'll see life. They will believe there's a future for them and that they can still live a normal life.
Undetectable equals to untransmittable. Wow. It's a new term in South Africa. One that we're still getting used to. But it's a very nice ring to it. Wow, now why should someone stigmatize me? I'm just like everyone else. I'm untransmittable, I'm undetectable. At the moment we are using a tool, a conversation map. We're using it to do a treatment literacy. It just makes everything clear. When I talk about a child, there's a child in the conversation map. When I talk about a couple, there's a couple in the conversation map. They could actually see and visualize the community they are in. It's become interactive and it becomes fun. It was very exciting showing people on the conversation map, saying this is my journey. I mean, I came from a viral load of 10 million copies. Now it's undetectable, so it's possible for all of us. I actually divided my kids and say to my other one, you gotta take this one and you gotta take that one. I really thought I was going to die, but here I am today.
The Universal Declaration of Human Rights recognizes that the inherent dignity and equal and inalienable right of all members of the human family is the foundation of freedom, justice, and peace in the world. The Declaration also enshrines the right to health and well-being within the context of universal respect for and observance of human rights. Ending HIV stigma requires defending the human rights of all people against intolerance, inequality, and invisibility, a concept both universal and individual. Actioning a future with zero HIV stigma translates simply into every one of us being treated, viewed, and respected as human first.
The first letter of HIV is human. Behind every statistic, behind every piece of data, there is a human being there who is living with, who is having the struggle, who is fighting the fight, is going through their journey. We, as positive people, are much more than our status. We are family members, we are loved ones, we're partners, we're colleagues, we're workforce. We are fully fledged human beings with so much more to give.
You might have, yes, a lot of people that are experts in science, that are experts in medicine. But if you don't include those that are experts in their own experiences, there's going to be a huge gap.
One of the successful campaigns that I've seen my organization run is the HIV Positive campaign. HIV Positive is printed in bold on t-shirts, on jerseys, and that everyone wears, whether someone living with HIV or not. This helps to break the social stigma, seeing the people first. You can walk around with a t-shirt that boldly says HIV Positive, with no one looking at you funny, with no one seeing you as weird or someone that is going to die.
We're all part of a network, probably sometimes disconnected. We need to connect the dots. Before I'm a trans woman, I'm human. I am human before being Latina, and I'm human before being HIV positive.
As a Black person, before you know about my HIV diagnosis, you see the color of my skin, right? It's almost like the cry that we have when we say Black Lives Matter. Like, do you not see my humanity? First and foremost, before anything, it seems simple, but simple ain't always easy, right?
I am a friend.
I'm a mother.
I am a trans woman.
I am a brother.
I am a PrEP advocate and user.
I am a sister, a daughter, an auntie, dog mom, and just all around fabulous Black girl who's magical.
I am a drag queen.
I am a person living with HIV.
I am Latina.
I am a researcher.
I am a proud member of Zeta Phi Beta Sorority Incorporated.
Soy orgulloso puertorriqueño.
I am a person living with HIV.
I'm a survivor.
Yo soy humano. I am human.
I am human.
I'm human.
I'm human, period.